So scar visibility on darker skin can be challenging because darker skin has more elasticity, so we can advance the scalp more forward, which allows me 2.5, 3, sometimes even more than 3 centimeters of advancement. However, the skin is very soft, and this means that the scar tissue is equally very, very soft. There's a greater tendency to be stretched, and also there's another element, and this is the pigmentation. Patients with darker complexion have more pigmentation in their skin, and scar tissue is not skin, which means it's a surrogate which looks ideally similar but never the same. What I mean with that is there is no hair growing into your scar. It can grow through your scar, but you don't have hair follicles in a scar. You don't have any sweat glands in your scar, no sebaceous glands. It's just a product that the skin produces which ideally looks very similar to the skin. In some cases you can end up with a bright line where the scar sits in a patient with darker skin. And I usually say worst case scenario could be something like the color difference between the back of your hand and your palm. The options you have then is you should wait a year for the scar to heal, and this time you should be covering it up with some makeup, and then afterwards, if this is something that is bothering you, then it can be done with medical tattooing by actually tattooing a pigmentation of your color into the scar, and then this makes it pretty invisible.